Herpes. Herpes is a common viral infection caused by the herpes simplex virus, HSV. There are two main types of herpes simplex virus, HSV1 and HSV2. HSV1 is typically associated with oral herpes, which causes cold sores or fever blisters around the mouth and on or around the lips. HSV2 is primarily associated with genital herpes, which causes sores and blisters in the genital and anal areas. However, both types of HSV can infect either the oral or genital areas. Key points about herpes. Transmission. Herpes is primarily spread through direct contact with the sores, blisters, or mucous membranes of an infected person. It can be transmitted through vaginal, anal, or oral sex, as well as through kissing or other close physical contact. It's also possible to transmit herpes even if there are no visible sores, as the virus can still be shedding and contagious. Symptoms. Many people infected with herpes do not experience symptoms or have mild symptoms that can be mistaken for other conditions. When symptoms do occur, they often include painful sores or blisters in the affected area, itching, burning, and flu-like symptoms such as fever and swollen glands. The initial outbreak is usually the most severe, and subsequent outbreaks tend to be milder. Recurrent outbreaks. After the initial infection, the herpes virus remains dormant in the body's nerve cells. It can become active again, leading to recurrent outbreaks of sores and blisters. The frequency and severity of these outbreaks can vary widely among individuals. Diagnosis. Herpes is typically diagnosed based on the appearance of the sores and blisters. A healthcare provider may also perform a swab test of the affected area to confirm the presence of the virus. Treatment. There is no cure for herpes, but antiviral medications can help manage and shorten the duration of outbreaks, reduce the severity of symptoms, and reduce the risk of transmitting the virus to sexual partners. These medications can be taken during outbreaks or as a daily suppressive therapy to reduce the frequency of outbreaks. Prevention. The use of condoms or dental dams can reduce the risk of transmitting herpes during sexual activity, but they may not provide complete protection, as the virus can be present on areas not covered by the barrier. Avoiding sexual activity during active outbreaks and practicing good hygiene can also help reduce transmission risk. Emotional impact. Herpes can have emotional and psychological effects due to the stigma associated with the infection. It's important to communicate openly with sexual partners about herpes status and take steps to manage both the physical and emotional aspects of the condition. If you suspect you have herpes or have been diagnosed with it, it's important to talk to a healthcare provider for guidance on managing the infection, reducing the risk of transmission, and addressing any concerns you may have. Thanks for watching. Please subscribe.